studies now indicate that up to 50% of heart attacks and strokes could be triggered by oral bacteria.
Hello and welcome back to another episode of the Birth Lounge podcast. All right, you guys, I have been on this health and wellness journey for quite a while now, and I feel like every day, every week, every month, every year, I get a little bit deeper, which also equals a little bit healthier and a little bit crunchier. As I have really dug into a holistic lifestyle for myself and for Mr. HeHe, I have found that has expanded into other areas of our life, like holistic vet care for our puppy and holistic dentistry. If you're not familiar with holistic dentistry, it's a tad bit different than traditional dental care because it takes, well, a holistic approach. Traditional dentistry focuses on addressing dental issues within your mouth, duh. But holistic dentistry is going to focus on addressing dental issues while also looking at other parts of your body, like emphasizing the connection between oral health and overall well-being, like your gut health, your mental health, and other places of your life that may be causing unhealthy oral health. So if you're like me, you go to the dentist every 6 months, and I had a dental appointment coming up that just happened to coincide with my first trimester of pregnancy. Now, I think we're all probably pretty aware that x-rays in the first trimester, even the second and third trimester, are a no-no, but you guys had so many other questions. I also think that probably something that's super well known is that being pregnant can pull out calcium from your bones and your teeth, causing a lot of pregnant women to actually experience cavities during pregnancy. So then what do? Are you able to get those fixed in pregnancy, or do you have to wait until your baby is out? What about more emergent dental care? Is that safe in pregnancy? Well, I'm super stoked to have on Dr. Clayton, who is a functional and biomimetic dentist who focuses on holistic cavity prevention, airway health, and innovative biologically sound approaches to restoring teeth. One fun fact that I found out about Dr. Craig is that he actually had a home birth with his wife with the birth of their children, and he jokes that if he wasn't a dentist, he would actually be a midwife. So obviously, I love him even more. He also has his own podcast, the Dentistry Disrupted podcast, and he's on a mission to shift the dental industry toward a more patient-centered, root-cause focused approach. So obviously, you know, he is our jam. If you're a health girly like me and you are knees deep in improving your health and your overall well-being, this episode is going to be right up your alley. I'm so interested in gut-brain connection. I had no idea how much your oral health impacted both of those things. In this episode, we're going to talk about oral health and fertility. Is flossing really that important? Cavities in babies, x-rays, and the balance of preserving natural tooth structure with restoring function and aesthetics. I'm also going to pick his brain about the controversial root canals. Finally, you're going to hear us dive into fluoride and whether it's actually important or not. This is one of my favorite episodes to date. So, without further ado, Dr. Craig, welcome to the show.
Thank you. I am so excited to be here.
I'm so stoked to have you. Obviously, I reached out to you to say, we come on and talk about dental health. Will you tell us about holistic dentistry? But the more I have learned about you and your love for birth and your love for women's health and your love for just like holistically loving people, oh my gosh, it feels so complete to have you here. So thanks for joining me today. I'm very, very excited for this conversation.
Oh, it's just wonderful to be here. When Eliza told me about this invitation, I was just ecstatic. This feels like I've made it in my career. Because if I would have found midwifery sooner and really I have an uncle that was an OBGYN, and his job satisfaction was just super high, like over 10,000 births in his career, and just loved his job. And then after the birth of especially our second child at home, I thought, wow, this is amazing. So if I could go back and do it again, I may have chosen midwifery instead of dentistry, but here we are. So I'm doing the best I can to help educate about the impacts of oral health, especially and in this case as it relates to pregnancy and fertility and birth outcomes. So
I love that. Maybe once you retire from dentistry, you can go back and be an old grandpa midwife.
I've thought about it. I've thought about it.
I love that so
Like,
much.
all right, how much training, how much school do I have to commit to again to do that?
Hey, it may be worth it. There's something about birth that just it pulls you in and it envelops you. It's just something that you cannot get away from. I love birth so much. And I'm just now pregnant with my first child, and this is something I've been doing for 10 years. And people always were so surprised to find out that I was a doula that didn't have my own children, and I knew so much about birth and I was so committed to it. And for me, it was like not a choice, but more of just like a soul calling. I felt so called to help women in their birth, and I feel that from you as well. I think that maybe one day you do have a little midwifery career ahead of you.
Maybe we'll see. I am definitely open to the idea
I love
for
it.
sure.
Okay, on the topic of your current career, before you change to midwifery, I know that obviously all of us are aware of healthy oral health, and we know to brush our teeth twice a day. We know that, what we were taught in second and third grade, rinse with fluoride, don't eat sticky candy. But the older that I've gotten, and now that I'm pregnant and I'm starting to be even more aware of environmental toxins and things that I put in and on my body, dentistry continues to pop up, and I was so not prepared for that because I have good oral health and I go to the dentist and I felt like I knew a lot. But the more that I dig into it, I'm like, oh my gosh, I know nothing. So before we dive too far into the meat and potatoes, let's define what is holistic dentistry and how does it really differ from that traditional dental care that I think a lot of us think about when it comes to our dentist.
That's a great question. I holistic dental care, and I like to say functional dental care, especially because functional is a word that's becoming more common as a descriptor for holistic medicine. It's really taking into account the entire person, right? We're looking at not only systemic health factors, but also social factors. And with that, everything's so interconnected. Like we can't just look at the mouth without looking at everything else, mental health. And maybe the patient is pregnant or has hormonal imbalances or micronutrient deficiencies. These things all play a factor, play a role into oral health. And then there's also things that we can detect even in x-rays that are indications as to whether there are diseases present in the body. For example, on my father, who is 68, I did a 3D x-ray to look at a couple different things, and I caught that there were some calcifications in the arteries in his neck. And while they're minor, and I said, "Hey, Dad, you really should go to a cardiologist, get an ultrasound of this." And while they are minor, and his blood pressure checks out altogether, he checks out as a healthy man for the
Mhm.
most part. Like he goes to his routine physicals, everything looks good, gets the stamp of approval. But given his family history of cardiovascular events, heart attack especially, the cardiologist decided, let's put you on a low dose blood thinner just to help prevent any further buildup. And then we could take a step further and look at his oral bacteria. But that's an example of holistic or functional dentistry. We're looking at more things and looking for the signs of disease elsewhere, and also understanding how everything is connected to each other.
Okay, now answer me this. Do you think, I guess two questions. Do you think a traditional dentist would have seen that on an x-ray? And would they have brought that up to that patient? Or do you think they would have just been like, that's not in my wheelhouse. I'm not going to say anything.
Fortunately, in that case, I do feel like that is something that's on the radar of most dentists.
Okay.
So that's fortunate and that is common practice, but it is something that's surprising to people, so that's why I mention it in particular. Now, taking that a step further, looking at the composition of the bacteria in the mouth, that is something that's not common in traditional dentistry because there's a saying in this holistic community or in the community that's aware of the effects of periodontal bacteria that cause gum inflammation and blood vessels. We like to say plaque on the teeth is plaque in the arteries
Wow.
because the same bacteria that will form plaque and a tartar or calculus on the teeth get into the bloodstream and they can do the same thing. They can take the minerals in the bloodstream and start to form plaque and atherosclerosis, so plaque in the arteries, which causes narrowing and other issues. And in fact, some studies now indicate that up to 50% of heart attacks and strokes could be triggered by oral bacteria.
Wow. Okay.
Yeah.
Dig in a little bit more to that because that's something that I have been learning a lot about in the last couple of months, in the last like 4, 6, 8 months, is how connected our oral health is to pretty much all of the rest of our body, especially cardiovascular and our gut health.
Yes. So the gut microbiome and the skin microbiome are well studied and well mapped. So we have a lot of understanding about those microbiomes. But the oral microbiome is not as studied. And so we don't know as much information. We don't have as much information about the oral microbiome compared to other microbiomes, but some interesting connections. So we talked about heart disease, strokes, heart attacks. There's now a tight connection that's been established between oral bacteria and different forms of cancer. For
Wow.
example, patients with breast cancer, when the microbiome of the breast tissue is analyzed, it's not uncommon to have a high amount of oral bacteria that are disease causing in the mouth. And in lines with pregnancy, the placenta was used to be thought of as a sterile organ, a sterile environment, but we've known for over 10 years now that's not true.
Hmm.
The placenta does have its own microbiome, just like the mouth and the gut and so many different areas of our body. And we find a high degree of bacteria in the placenta that's oral,
Wow.
that are commensal, or meaning they're good bacteria that are found in the placenta. But if we're finding oral bacteria in the placenta, what's now being studied is okay, if the oral microbiome is out of balance and is in a state of disease and inflammation, is that bacteria getting to the placenta? And the research indicates that this could be the link between preterm birth and low birth weight, where this bacteria is getting going from the mouth into the bloodstream to the placenta, causing inflammation in the placenta, which then can trigger that preterm birth. And
Yes.
it's something like this could be screened for in the hospital. This could be screened for easily in the offices of midwives and OBGYNs, it's something that merits more research and more screening.
Totally. Okay, what about oral health and things like depression and anxiety? Because we know those things are connected to gut health. So, do we know anything that's connected to oral health and kind of mental health disorders?
Yes. And what has been studied at large is the gut microbiome. And so looking at oral bacteria in the gut. For example, strep mutans is
Mm.
the bacteria that's the main player in cavities. And when that is found in abundance in the gut, there's a higher incidence of anxiety, depression. So it can't be established as a causal, but the correlation is tight enough that it's now considered a risk factor. So we
Okay.
have a person with a lot of cavities, those bugs are getting into the gut, those have an influence on the brain, and then that anxiety, depression, and especially depression, can lead to lack of oral hygiene habits. And so then the problem's like a positive feedback loop where it just feeds into itself.
Wow. If you guys are watching on video, you're seeing like my light bulb moments go off. Oh my goodness, it makes so much sense. And it's just this nasty loop that you can get into that is super unfortunate and it just declines your health. Okay, what about probiotics? So, when anyone talks about poor microbiome in your gut health, for me, instantly, I'm thinking probiotics. Are we seeing the same benefits when it comes to oral health? Do we know if there are probiotics that are particularly beneficial for oral health, or is that something that we still need more data on?
We still need more data, but the current data that we do have shows a correlation between improving the health of the microbiome and using supplementing with different kind of bacteria.
Hmm.
So oral probiotic supplements are definitely on the rise. There's a company that's been around for quite a bit that is the company's called Probiora, and it has been created by a doctor, and they have clinical research. But three of the bacteria that they use in this supplement, they're all fun names. But Streptococcus aureus and Streptococcus oralis and Streptococcus rattus. So this is based on clinical research that these three bacteria are helpful in combating disease and helping to establish a good, healthy oral microbiome. While it's not, I like to say that not any one product is like the silver bullet in establishing or reestablishing oral health. They're all tools that can work together. So, yeah, it's exciting. Again, the oral microbiome, we don't know as much about it, not nearly as much compared to gut microbiome, but there are some very promising things on the rise that make us all hopeful that we'll be able to understand it better and be able to better treat the diseases that are most common, such as gum disease and caries disease, which is what causes cavities.
Wow. Okay. So I think something that's on everyone's mind when they're thinking about building their family is fertility. But something that I've learned that it's on no one's mind when it comes to fertility is your oral health. And so many people don't think about your dental health as part of your fertility journey, but it absolutely is. This is something I've known for a long time. And when we work with clients in our fertility sector that are really struggling to either get pregnant or stay pregnant, oral health is something that everyone is almost always so surprised to hear me suggest. You need to find a good dentist and have some good discussions with them about your oral health. Talk to us about the link between oral health and fertility.
Okay, oral health, what I'm most concerned about when I look at oral health is yes, the bacteria makeup, and we've talked about the bacteria in the mouth that are found in the placenta, but the bacteria that cause inflammation in the mouth are so good at causing inflammation, period. And so the problem with gingivitis or periodontal disease, which affects the gums around the teeth and affects bone health as well around the teeth. And when there's inflammation, there's bleeding. And when there's bleeding, there's an open door for bacteria to get into the bloodstream. And so, because these bacteria are so good at causing inflammation, they will do so other places in the body. And so, they really impact systemic health. And that's why we work so hard in my practice to address oral inflammation. And I tell patients all the time, I say, look, teeth are important, yes, but they're not my priority. Like, unless teeth aren't going to impact your health, except in two situations. Really, one, you don't have enough teeth to chew and get obtain proper nutrition, or two, you have an infected tooth. Otherwise, cavities, fillings, crowns, whatever, they're not going to affect your overall health. But gingival inflammation is the most underdiagnosed oral disease and untreated because there's this practice in dentistry where we either look at doing like basically a wellness check or healthy cleaning where there's a couple areas we need to address. They come in, you get your teeth cleaned for 40 minutes, and then you go. Or it goes to the extreme of you're losing bone, you have extreme tissue inflammation, maybe you have infection in the gum tissue around the teeth. Now we need to do a deep cleaning, but at the same time, the treatment is not oral probiotics and gentle oxidizing rinses to treat the bugs. In other more modern treatments, the treatment is, well, go in, remove the plaque, remove the calculus, and do some rinsing around the teeth, prescribe them a really aggressive rinse that kills so much. And
Everything
that
good and bad.
yeah, and that's the standard versus there needs to be this middle ground of patient comes in, there's inflammation. Yes, we're not having bone loss, so it's not classified as periodontal disease, but they still have inflammation, they still have bleeding, and if we don't actually treat that and we're just treating the tartar on the teeth, just removing the tartar and saying, okay, now you're good, and also not looking at systemic issues like hormones, then we're not treating the disease. And that disease, that chronic inflammation, will continue to be a source of inflammation systemically for the patient's entire life.
That is so fascinating to hear you say because as you were talking, I was thinking about hormonal health and like autoimmune disease. There must be a connection between oral health and these two things.
Yeah, absolutely. And it just all comes back to that inflammation and those oral bacteria that cause so many issues. And one of the bacteria called P. gingivalis is we know that it crosses the blood-brain barrier
Wow.
because we see it in the brains of patients that pass from Alzheimer's dementia,
Hmm.
and it creates a toxin called gingipains, which are associated with these changes in the brain that eventually lead to dementia and then eventual death. It increases a patient's risk of dementia or Alzheimer's if certain bacteria are present in the mouth in a high enough level. So it's, oh, and then going back to fertility, there was a study done looking at sperm motility and sperm count in males, and that goes without saying. So there was a study that looked at sperm motility and health and sperm count. And what was found was that patients that were having, patients that were studied that were having a hard time conceiving with their partner there was a higher rate of periodontal disease or gum inflammation. And so they were screened for this, and they were specifically looking at gum disease as it relates to fertility. And when gum disease was treated, we saw an increase in sperm count and motility, and I believe over 80% of these male subjects. And within 3 months, the majority of them were able to conceive.
Wow.
Yeah,
Oh my goodness. Imagine
yeah,
the number of families that might be able to avoid more emotionally hard, just like IVF, IUI, just other procedures that are so emotionally tough and financially tough and mentally tough, time constraints. Just if you could just get your oral health in control, that's
yeah.
amazing.
Yeah, it's just another factor to eliminate, right? If a couple's having a hard time conceiving, this is something that needs to be on their mind. It needs to be on their provider's mind of let's make sure the oral health of both is ideal, that these bacteria are not present in a high amount. They'll always be there, but we want to make sure they're non-detectable, that the good bacteria are what's maintaining the balance. So it's a factor that must be addressed and treated. And then if we eliminate that, the data shows that we could have improvements in fertility outcomes. It's pretty cool.
And quickly, 3 months is nothing. People sometimes try for years and still don't have any sort of answer, and all they're being told is it's unexplained fertility, and we're just not sure what is going on here. And what if it all just goes back to your oral health? That is so fascinating. Okay, talk to us about what would cause things like gum disease and I guess your teeth not being healthy, lots of cavities. What are we doing? Is it lifestyle? Is it diet? Is it genetics? Is it all of it? Is it the number of times you're brushing your teeth? Is it not brushing your teeth? Is it over brushing your teeth?
Yeah. Yeah. Boy, all good questions. Generally, it's a combination of dietary habits, making sure that there's enough micronutrients present and vitamins, minerals that are at a healthy level, absence of other inflammatory diseases. And then oral hygiene habits are important, of course. So flossing, brushing are important because it's mechanically removing plaque and bacteria, disrupting that microbiome that forms on the teeth, which helps to prevent it from shifting to a state of disease. So that's, of course, important. Oral care products is something that's underrated because when the saliva is healthy, that is the best protector against disease, not oral care products. So there's this myth that, oh, if I use the bright product, I'm not going to get cavities, or if I use the bright product, I'm not going to get gingivitis. And that's what's been programmed into us since a young age. But the reality is, those oral care products could be making the condition worse, or at least perpetuating the condition, or preventing the ability to heal. And so I'm a big proponent of let's keep it simple. And if you don't have a good oral care product to use, don't use anything
Hmm.
because allowing your saliva and stimulating more saliva and removing plaque more frequently throughout the day, that's going to make a bigger difference than using a specific oral care product. So if you have to choose one or the other, let's drop the oral care product and focus on removal of plaque and keeping the mouth neutral and then treating conditions like hormone conditions like estrogen dominance that can lead to changes in the saliva, which increase the risk of cavities and gum inflammation.
What? Okay, tell us about that because I feel like so many of my audience members are listening and they are either deep into or they're starting to get into the idea that we need to be checking on our hormones, even if our periods are normal or seemingly normal. If you're having PMDD, if your cramps are really terrible, if you're having really long or heavy periods, it might be something like estrogen dominance. I had no idea that it was connected possibly to oral health.
Yes, yeah, absolutely. So estrogen dominance and pregnancy fluctuations in hormones can decrease the saliva flow. And again, saliva is really important to protecting oral health. So it can decrease saliva flow and it can make the mouth more acidic. And then it also makes the gums more sensitive to plaque and bacteria. Have you heard of pregnancy-induced gingivitis?
Yes.
Okay, that's directly related to hormones. And so if there's that same amount of hormone instability or dominance, then we're going to see the same effects outside of pregnancy. And again, when that gum tissue gets inflamed, then it's now an open door for bacteria in the mouth to get into the bloodstream. So addressing hormone levels. Like I asked a patient one time, she said, I just always have gum inflammation. I checked her during my exam. Yeah, you don't really have much. I told her, you don't have much calculus buildup. You don't have much plaque. And I asked her, have you had your hormones levels checked? And she said, yes. I said, do you have estrogen dominance? And she said, yeah. How'd you know? I said, because I'm not seeing these other risk factors present. And so what else is at play? said, we got to work on this, and you have to be extremely careful and diligent in your oral care because you're just patients are more prone to this inflammation. I like to say it's like the an over dramatic response of the body to plaque and bacteria.
That is so fascinating. Oh my gosh, I'm learning so much. Okay, you touched on a sore subject for probably a lot of people because we just don't do it, but how important is flossing really? Should we actually be flossing every single day? And what happens if we miss a day or two? Is it a lot that we're paying in our health?
Yeah, so it's about 40% of the tooth surface is not being cleaned.
Mm.
Yeah, and so the key with flossing and brushing is disrupting the oral microbiome and it's removing the plaque that feeds the microbiome. And the bacteria that cause disease in the mouth like to hide in this plaque. It's where their food source is. It protects them from the saliva, it protects them from oxygen. They don't like oxygen. And that's why they hide in the gum tissue and in the plaque. So if we're not removing the plaque that forms between the teeth and below the gums, then it's going to be much harder to heal. And a big thing that contributes to plaque formation and speed of formation is the presence of highly processed foods. Because I like to give the example of, have you ever eaten a sweet or refined food or candy, for example, and then you feel your teeth afterwards and they feel like fuzzy?
Yeah, or they have that film over them.
Yes, versus if you eat a meal of whole food and you feel your teeth, you're not going to notice any of that.
Hmm.
And that's why we definitely have increased incidence of cavities and gum disease worldwide is because of that shift in our diet. Our ancestors didn't have access to toothpaste and toothbrushes as we know them today. And so diet plays a factor. And then you get to pregnant patients are much higher risk of oral disease. And one of the factors is, and none of these factors, they can be tipping points, but it's not just brushing, flossing, not eating sugar, using fluoride, those sorts of things that are always hammered in conventional dentistry. But pregnancy, morning sickness is a problem, right? And for my wife Eliza, the way to keep morning sickness at bay and not vomit all day long was to eat something every 2 hours. And one of the only foods that she could eat predictably was cereal and milk. So
Oh,
whole
I'm
milk and
having
cereal.
such
Well,
cravings for cereal and milk these days.
yeah, yeah, and it's one of the few foods that she could keep down that always sounded good. And so it's like you have to do what you have to get any nutrition you can during pregnancy. And so in that case, if you take that increased exposure or frequency to carbohydrates, refined carbohydrates that make the mouth acidic, that drives demineralization of teeth, which is what causes cavities. And then you add vomiting into that, which is extremely erosive to teeth, and you have this perfect storm. Oh, and also with pregnancy, you have a decreased amount of calcium and phosphate in your saliva, which is necessary to remineralize, and you have a decrease in calcium internally in the teeth, just like we'll find in other bony structures in the body, especially if there's deficiencies. So you have this perfect storm of all these factors working together, and that's why so many female patients will experience an increased risk of cavities postpartum is because they may say, "Oh, I never had a cavity before," and then I had kids and now I get multiple fillings every year. It's because all these risk factors have been at play and they've not been treated properly. And then the result, unfortunately, is disease.
So, wouldn't, and this is just me thinking out loud, but wouldn't the increase in milk consumption be good if we know that calcium is decreased in our saliva and we know that the baby that you're growing is pulling calcium from you and your calcium stores. So, replenishing that milk, could that account for why a lot of us are craving milk and cereal?
That's a really good theory. I wouldn't be surprised. And the best sources of calcium are our dairy, our animal derived, calcium rich plants. It's hard, it isn't bioavailable.
Okay.
And the way to make calcium in plants more bioavailable is to cook them in an animal-derived fat, butter or ghee or tallow. So someone that's vegan, for example, is going to struggle a lot more with oral health than someone that's not vegan or even vegetarian. So it's and so yeah, that's an issue if it can be hard to get calcium and even through supplements. There are some better forms of calcium. There's one that's seaweed derived. It's called algacal,
Okay.
and that one has been clinically shown to improve bone density by 1% every year.
Okay.
And that 1% adds up when you're adding it up over 5, 10, 15, 20, 25 years. It makes a difference.
Yeah. Okay. It also must play a role that a lot of us, and I haven't had any morning sickness. I've been very lucky. I've been watching my hydration and my protein intake, and I've been putting mineral drops in my water to make sure all that stays good to hopefully stave off some of the morning sickness. But what I have found is when I brush my teeth, I gag
Yes.
so bad. And it's not like I'm touching the back of my throat. It's just like having a toothbrush in my mouth makes me gag. And so I'm able to push through because I think I am so type A anal about my dental hygiene. But I imagine that if someone, especially someone who maybe is afraid of throwing up or who already is really struggling with really bad morning sickness, you probably have an aversion to brushing your teeth because you're like, I don't want to throw up.
Yeah. Okay, so I've got a trick for you. Put salt on your tongue before you brush. I
Like,
don't,
pour it right on.
yeah, or yeah, you can pour it on or you can put it on your hand and lick it. I don't know why, but this is a trick we use in dentistry to take x-rays on patients that gag. And it makes it dramatically easier for the patient to tolerate the x-rays. So I'm not sure why, but that is definitely something to try, and you may find that decreases that reflex enough that you're able to brush more comfortably, and that could be something that's especially helpful for patients that have that fear of vomiting.
Yeah. Oh my gosh. So hopeful. Okay. That makes me think about the question of are we rinsing after brushing our teeth? Because I imagine that a lot of people want to rinse that salt out. So it brings me to the question of after we brush our teeth, do we leave it on or are we rinsing?
So rinse. Unless you're using a toothpaste that helps with remineralization and calcium and phosphate supply. If you're using that and not using a rinse, then you want to leave that on the teeth. But if you're going to use a rinse, then I would say you brush your teeth and then rinse afterwards. Now, there's this perpetual question of do I brush my teeth right after I eat or should I wait 30 minutes? And the research shows that it's really negligible except with vomiting.
Oh,
So, brushing right after vomiting is shown to remove enamel. And so, in that case, no. After you vomit, rinsing with something like water with baking soda in
okay.
it to help to neutralize the acid in the mouth and get that mouth back up to normal. Rinse the mouth out, and then you exchange the taste of stomach acid for salt, which is going to be a lot better. Or you could use something like a xylitol rinse if the salt is just too too potent. So those are some tips for that.
And then wait, what, 30 minutes and brush your teeth?
Yeah. Yeah, wait
Okay.
about 30 minutes. We want that mouth to return to neutral, back up to a neutral pH.
Got it. Before brushing.
Yeah,
Wow.
which it
Okay.
can take up to 30 minutes to get back there. And some acids, like citric acid, one of the reasons why citric acid, that's lemons, fruit derived, especially citrus, is so erosive for teeth is that it can continue to pull out calcium from the teeth even after the source has been eliminated. For example, you drink lemon water, you finish your lemon water, the citric acid is going to continue to have an effect on the teeth for some period of time after. So it's interesting stuff.
So what about someone like me who is craving oranges? I probably am eating like 4 or 5 little baby tangerines every single day at this point in pregnancy, and I'm about 13 weeks pregnant. Should I be doing something to protect my teeth?
Just rinsing with water afterwards
Okay.
is helpful in trying to limit snacking.
Okay.
Again, pregnancy, I like to say a lot of the rules go out the window because at the end of the day, you have to feed yourself. But trying to mitigate it with rinsing with some water, using xylitol afterwards will help to mitigate that.
Okay, cool. And then what about coffee? Coffee always gets a bad rap when it comes to teeth, staining, acidity. What should we know about drinking coffee and brushing our teeth? Should we brush before, but then it makes your coffee taste so terrible? Should we make sure that we're sitting and drinking our coffee within X amount of minutes? Do we wait so long before we brush our teeth after coffee? What do we need to know about that?
So, black coffee is actually fairly neutral.
Okay,
So it's not acidic. So black coffee, where it becomes acidic is when we add sugar to it, because
that's me.
when carbohydrates are broken down in the mouth becomes acidic. And so that's the key. So something that you could use is looking at using an alternative sweetener in your coffee instead of using cane sugar or something else, using like an allulose monk fruit blend or even a xylitol. You can buy xylitol, and the nice thing about allulose monk fruit and xylitol is they all taste like sugar, so they're not going to have, unlike stevia, they're not going to have a really funky aftertaste, and they're all food derived. So that's something that you could put in your coffee instead that would not feed that bad bacteria in the mouth that drives cavities.
So you mean my double sweet caramel latte macchiato is not great for my teeth?
Not great, and not great for systemic inflammation either. But if that's what you need to fuel yourself during pregnancy, then go right ahead. But there are some better alternatives. So,
That's funny. That was a pre-pregnancy thing. I do a caramel iced coffee from Starbucks. It is like my weakness. Although, listeners, and this is not sponsored at all, I have just recently switched to Purity coffee
okay,
about 4 months ago, and I love it. I find that it doesn't give me the jitters. I find that my anxiety is so much better. I feel really good about it being mold free and third party tested. So I haven't noticed any difference with that necessarily, but I just feel good about what I'm putting in my body. And especially now that I'm pregnant, it's funny. I switched 4 months ago. I found out I was pregnant 3 months ago. And so it was just a funny crosshairs there where I was like,
cool.
wow, look at that. I've switched coffees to something that is certified mold free, and a month later I fell pregnant. So it was just funny how that worked. But yeah, if you're looking for a cleaner coffee, you guys, Purity is an awesome, not sponsored option for you. So check it out. I have found it super easy. They deliver at the subscription. It's great. Okay,
I need to check that out. I've actually was talking to another provider a couple weeks ago, and he said that he started ordering Purity coffee and that he really likes it.
yeah, I've loved it. I think it tastes really good. I use it in a Keurig, and so it comes in pods, but they also have whole beans and they have ground beans. And like I say, it's a subscription. It gets mailed right to my house. I have found it to be really easy and yummy, and I just sleep a little better at night knowing that they're third party tested, certified,
Yeah.
free, and it makes me feel better about consuming the coffee. And now putting the creamer in.
But that's another thing too. Milk is between that 6 and 7 pH
Okay.
range, so milk isn't as big of a concern. So if you were to do a dairy creamer, a lot of things like oat milks and soy and almond can have sugar added to them, but the the milk is neutral enough that's a benefit. And yes, there is sugar present, but we also have proteins and fats. And with raw milk, there's 6 times more antioxidants. But I also want to say, just going back to the Starbucks drink, I do want to say, though, I'm not a proponent of complete elimination. I feel like there's space for everything, and so that's something I strive for in my education is like, hey, you can still have the things you like. Just pay attention to how I like to say how you eat something is more important than what you eat. Like
Love that.
the person that's drinking a Red Bull over 10 minutes is the effect on their teeth is going to be negligible compared to the person that sips the same amount over 2 hours.
Wow. How come?
They just exposure to acid. So a lot of what drives oral disease is the acidity of the mouth. and sipping on a Red Bull or a coffee, a sweetened coffee for hours, just keeps the mouth acidic. And so then the amount of mineral breakdown starts to become greater than the mineralization.
Okay, on the topic of remineralization, what are your opinions on remineralizing toothpaste? Because I know that there's some controversy with traditional toothpaste, the SLS, the microplastics. Some people are really anti. Do you think that everyone should be on a remineralizing toothpaste? Is that something that we should be using proactively, or should we wait until maybe we have a problem and then implement it?
This is a good question, and I have lots of opinions about things for different reasons, but certainly just right off the bat, eliminating anything with SLS is a huge start. Any of the products from Procter and Gamble and Johnson, just like the big brands, Crest, Colgate, Listerine, Scope, all that stuff is terrible. But we have a lot of more holistic products on the market. For example, Boca and Rise have been very popular for a couple of years. But the problem I have with it is that it may not be doing exactly what we think it does. A couple things. I'm concerned about ingredients and third party testing. So, right off the bat, there's not tight FDA regulation. And as a result, we don't know how clean the products are. Especially, I tell people never use products that have bentonite clay or any form of clay because if they're not third party testing, checking for heavy metals and toxicity, then we don't know if it's clean or not. They may say, oh, we get it from a certified clean source. It's, yeah, but you're just taking their word for it. If you're not actually testing your product routinely, then you can't just take someone's word like, oh, it's arsenic free or lead free, or it's the reality is we're going to find those heavy metals in everything regardless.
Right.
We can't filter them out 100%, but if they're 700% higher than the accepted range, or even if they're just a little bit above the accepted range, it's like, why?
You want that in your body. There is a better option out there. There always will be.
Yes, exactly. So that's a problem. Essential oils are a problem for me because the research shows that it's a Goldilocks situation. If you have too little concentration, does nothing. If you have just the right amount, yes, it can be helpful, but this has been tested in a lab, not in vivo, not in subjects' mouths. And if you have too much, we have data that shows that it's toxic to human cells. So to put it in an oral product that's going to come in contact with a microbiome and with mucosa that is a more delicate tissue and is very good at absorbing, it just doesn't make sense. Sure, if they did third party testing and in vivo testing and said we have the perfect formulation, the perfect amount, it shows to decrease viruses and bad bacteria, it's shown to be non toxic, then great. But I'm not seeing those products on the market yet. And then, so I call them good intention products. So I'm not convinced. And then studies about hydroxyapatite show that if it's a needle shape, that it does lodge in the tissue. Most manufacturers in the United States buy from the same company that's called Fluid Nova, and they do manufacture a rod-shaped hydroxyapatite, which is safer. But the problem is that all these companies that buy this product are piggybacking on the research that this company did on their own formulation. So it's, yeah, you can buy a product that in their formulation has shown to be effective and stable, but now you put it in your formulation with essential oils and clays and whatever else you want, and then you expect to get the same result. Just it's like taking a cookie recipe, your favorite recipe from your grandma, and then throwing in all sorts of different ingredients and expecting to get the same result. You're not going to, and if you do, it's you were just lucky.
So should we be avoiding that in our toothpaste?
That is my opinion. That's
I
my
typically do
opinion.
as well.
Yeah, it just doesn't make sense. It doesn't make sense. It makes more sense to me to use something that's been proven like xylitol, making your own xylitol rinse. My favorite product is Elementa. It's third party tested, so it's proven to be non-toxic to human cells. It's very simple. It has a short ingredient list and it's designed to help the saliva work more effectively instead of trying to be this magic bullet of we're going to throw all these ingredients in here to do all this good stuff. When in reality, it's like we need something for remineralization, we need something for pH balance, we need something to target bad acid producing bacteria, and that's it.
Hmm.
We don't need much. And so that's why I like that product a lot.
So, on the topic of products, what about alcohol-based mouth rinses? Those can
Yeah.
be really bad because they kill
Bad, bad,
everything,
bad.
right?
Yeah.
Yeah.
Yeah. Super bad. It dries out the oral tissue. So not good.
And are you seeing more cavities with things like that where people think that burn, that sting means, oh, I'm killing the cavities, and maybe you are, but you're also killing everything else.
Yeah, it's definitely a risk factor. It's definitely a risk factor. It's not like cause and effect, but it's certainly something I screen for if a patient is struggling with getting cavities or struggling with getting canker sores. It's something I'll screen for. What products are you using? And if, especially if they're using products that are traditional like Scope and Crest, I tell them like just stop immediately, go home and throw it all away. And if they're getting canker sores frequently, I tell patients stop using all oral products. I don't care what it is, and go get your micronutrients tested.
And what did that test look like? Is it an oral swab? Is it a blood draw?
Blood draw. Yeah,
Okay.
blood draw is a deficiency in B vitamins, for example, can lead to thinning of the tissue in the mouth that's called mucosa. And mucosa is like what's on the cheek tissue or on the floor of the mouth. And if that tissue thins, then the immune system can be more responsive to pathogens or viruses that come in contact with the mouth.
Wow. Okay, you've mentioned a couple times X-rays. Opinions on X-rays, because I know people get very toothy about X-rays. We have a lot of strong feelings about X-rays as humans. When when is a good time for us to use X-rays, and is it really necessary to have them every 6 months or every year, like recommended in traditional dentistry?
The only time x-rays are justified every year is if a patient has active disease. If they're getting cavities, if they're losing bone from gum disease or have the initial signs of gum disease, yes, they're merited because they're going to show us the bone level around the teeth and they're going to show us if there are cavities present in the teeth. So that is merited, but if a patient doesn't fit those categories, then really they should be, I prescribe them every 2 to 2.5 years just to check to make sure things aren't changing. Or if we see a change in the patient, then let's do them earlier. Fortunately, x-rays have come a long way, and the radiation dose from
Okay.
x-rays is so low that OSHA no longer mandates that lead aprons be used.
Oh,
And
wow.
that's and OSHA's actually they're pretty conservative, meaning they have a lot of rules and they do not have wiggle room. They're very strict. And so if OSHA says we don't need lead aprons anymore for x-rays, you patients can elect it, then that means a whole lot because their standards for infection control and for exposure control is very strict.
So for a traditional dentist who really urges people to get x-rays 1 to 2 times a year, is it, and you don't, let's say this is someone who doesn't have some sort of issue or disease, is that just a money grab so they can bill your insurance?
It's insurance driven. It's just insurance pays for x-rays every year, so it's just the default.
Hmm.
It's default insurance pays for it. And I'll never forget a lecture that I had in dental school with one of our professors, and was talking about X-ray frequency and how he got after his assistants one time because they took X-rays and he didn't ask them to take X-rays, and he was giving this example of why do you take X-rays, and because we take them every year. I didn't ask you to take. I didn't prescribe X-rays. We just we take them every year. No, we don't. Why do you think we take them every year? Because insurance pays for it. No. We don't take x-rays because insurance pays for it. We take x-rays because we're screening for disease. And if the patient is healthy, we don't need to take x-rays. Now, for something like a 3D x-ray, that's a much higher dose of radiation, lower than it used to be, but it's still equivalent to flying round trip from LA to New York.
Okay.
That's the amount of radiation that that one receives. But what has to be weighed is the benefits. If we can catch things like calcification in the arteries or risk factors in the airway for sleep apnea or sleep disorder breathing, then yeah, you have radiation. However, if you have or disease in the bone, right? So a disease, a silent infection around a tooth that won't be caught or is very hard to catch with traditional two-dimensional x-rays. We do a three-dimensional x-ray and then it's very clear, oh yeah, that's unmistakable. There's infection in the bone right there. So in that case, then I think the radiation is definitely worth the outcome because not breathing well for decades or having a silent chronic infection for years has a much higher impact than the radiation exposure.
Sure. Yeah. Okay, I have a question about three things that have been on social media and somewhat in the news recently, and I think are buzz topics, if you will. Number one, mouth breathing. What do we need to know about mouth breathing, and how does this impact our oral health?
So mouth breathing makes the mouth more acidic. It dries it out so there's not that saliva that's bathing the gums and the teeth. And the saliva does so much. It's designed to it has antimicrobials in the saliva to target bad bacteria and help maintain a healthy microbiome. It has minerals to remineralize teeth. It has enzymes to start digestion. It's mucousy to help coat food so it goes down easier. Mouth breathing impacts all of this. And mouth breathing, you're going to have a higher risk of cavities, higher risk of gum disease, gum inflammation, just boom, right off the bat. So that's how it impacts oral health. But then mouth breathing is also associated with chronic poor sleep. Even if you're in bed for 8 hours, people that breathe through their mouth all night long will have decreased quality of sleep, feel more chronic fatigue, exhaustion, and less growth hormone release at night, and higher overall baseline of systemic inflammation. So you can take a person that has a good airway but has an open mouth posture, mouth breathing at night, put mouth tape on them. This is, of course, if they're not snoring, if they don't have sleep apnea. Otherwise, don't do it. It's dangerous. But you can take a patient and overnight, their quality of sleep, they're going to feel more rested. They're going to have a decreased incidence of asthma and allergies if that's something they've struggled with before, more growth hormone release, better recovery just with closing the mouth. It's really wild.
Do you have a brand of mouth tape that you particularly like?
I like the VO2 mouth tape, and we'll provide a PDF with links to our favorite products and discount codes as well. But VO2 mouth tape, the reason I like it is because it's third party tested. So we don't have plastics that are irritating the skin or off gassing of chemicals from the product because it's underneath your nose all night long. So I like that one, and it's just a strip that goes across the center of the lips, which is much safer than doing like hostage tape across the entire mouth. Not a fan. Not a fan.
Oh my goodness, it's so funny to hear you say that because when I first began mouth taping, I was like, I cannot sleep with this. And then the off-gassing, some of the brands I bought, I was like, I cannot stomach. And this was before I was pregnant. I was like, I cannot stomach the smell. There's no way I can sleep with this on my face. It was so bad. Okay, number two is fluoride. Such a hot topic. It's something that is just so deeply and hotly debated in the dentistry world. What are your opinions on fluoride?
So fluoride, yeah, this has been a hot topic for a while, but a couple things about fluoride. One, people don't understand the mechanism of fluoride, so I think that's important to cover first. Fluoride makes teeth 10 times more resistant to acid. So
Okay.
cavities is an acid problem, not a sugar problem. You can have a diet with low to no refined sugars and still get cavities
Hmm.
because there's sugar in grains and there's sugar in fruits and there's sugar in vegetables, and the bacteria that cause cavities don't discriminate against what type of sugar it is. They don't care. And so fluoride makes the teeth more resistant to cavities, and it also has an antibacterial effect. So that is why fluoride historically has been used. Now, even the ADA, when you look at fluoride recommendations, fluoride in water or low dose fluoride in toothpaste daily, the evidence for that is categorized as expert opinion. So it's not even hard data that shows this will reduce your risk of cavities or rate of cavities. It's we see these associations, but where it's actually proven to make a big difference is in office topical applications of fluoride to the teeth. And this is controversial, but I like to be evidence based. And the reality is, if someone is just in a chronic cycle of cavities, it is a helpful tool to use as a medication. Yes, does it expose you to fluoride? Absolutely. But doing it twice a year as opposed to every day is shown to be most effective. And it does make the teeth 10 times more resistant to acid, which is going to decrease the rate and risk of cavities. But again, that's fluoride should have always been used as a medication, never as a general, let's treat everybody with fluoride. Because if someone's not getting cavities and doesn't have a history of it, it's totally unnecessary. And now, recent court opinion from fall of last year in California, which was a comprehensive study of the effects of fluoridated water on health, were very clear. Clear enough that the court mandated that the FDA and EPA basically reevaluate everything as it pertains to water fluoridation. And so that's something to appreciate, those two things.
Because would you argue that a fluoridated mouth rinse that you swish around in your mouth and then spit out is much, much different than drinking low dose every single day, continuously all day long, especially for someone like me who I pretty much only drink water. Now that I'm pregnant, I'm drinking a lot of milk, but beyond that, it's only water that I consume.
Yeah, absolutely. And what's found in our food too, it's actually a pretty high amount in black and green tea. So
Wow.
unless you're buying like a loose leaf organic black green tea, it they often have much higher rates of fluoride content. And you're absolutely right. Doing a rinse with a fluoride is going to be much different, a lot less absorption. And that was what this paper showed is there's enough fluoride naturally occurring in the foods we eat every day than to be drinking it breaks that safe exposure limit every day. And it's not well controlled. It's supposed to be zero point 0.7, was it zero point 0.7 grams per, I don't, you'll have to forgive me. I can't remember the correct unit, so I don't want to say the correct units, but we also have evidence that shows that water treatment facilities are not across the board accurate.
Yeah, or adhering to those standards. They're just dumping it in.
Exactly. They may have very little or they may have a lot. And so that against is the major argument against fluoride in water. So
Mhm.
it's interesting. The action against fluoride has been focused on water sources and not like prescription medication in office, and for good reason.
Yeah. Oh my gosh. Okay, last thing about the controversial thing is root canals. I feel like every place I turn, people are talking about the harms of root canals and starting to be just really aware of, do we really need root canals? Are there better solutions if you have an issue that would be solved by root canal? And could a root canal actually cause health problems later down the line? Tell us your opinions.
Okay, so I like to say right off the bat, the talk should be about failed root canal treatments. That word or infected root canal treatment should be included always,
Okay.
because the overgeneralization that every root canal treatment is contributing or harming you is just that. It's an overgeneralization. So, yes, failed root canal treatments, terrible for you. It's a chronic source of inflammation and infection, 100%. That's why anybody with a root canal treated tooth, that comes in my office, I say, look, you really need to get a 3D X-ray. You can decline, of course, but you really need to get one because we can measure the bone density around teeth. Now, here's where the I try to be very objective with my data. Right now, the data suggests that if a tooth is root canal treated and heals, when we can confirm healing by looking at the bone around the tooth. So if we see nice dense bone that forms and persists around every millimeter of the root surface, it's an indication that there's not chronic inflammation or infection there because the bone isn't going to grow in if there is. Now, if there is a decrease in bone density around the tooth and signs of an infection and inflammation, then 100% it's going to affect every body system just as an infection anywhere in the body would. So I like to say I really stay on neutral ground of there's the data. If you want to removing a tooth is permanent, it's expensive, especially people that have root canal treated teeth. If they remove 3 root canal treated teeth, that could be $12,000 to $15,000 to replace those teeth.
Wow.
And that's a lot of money versus if we trust the data and do a 3D X-ray and confirm none of these have inflammation around the roots, none of these have infection, then we can make a more objective, educated decision of at that point, I feel like patients can give true consent. And that's my problem with the fear mongering online is patients they're not consenting properly because they don't know the other side of the story. They don't know the objective data. And so I'm big into that consent.
You sound like a tooth doula. You sound like a doula for your teeth. I love
It's
that.
all about consent. It's you take this out, there's we only have so many options to replace it. And the reality is the majority of the tooth structure is mineral. And so there's the argument of why would you leave a dead organ in your body? It's nails are dead, hair's
Hmm.
dead.
Hmm.
And so it's the majority is mineral structure and it's still connected by living tissue 360 degrees, all not 360 because it's not the top of the tooth, but 360 degrees of the root surface is connected by live tissue. So that's another thing I like to just throw that out there with that argument is it's not really that black and white.
Yeah. Yeah. And what percentage of root canals would you say either fail or end up in that kind of infected category? A lot?
So the statistics when I was in dental school, the statistics really they come from like the 80s and 90s, some of the big studies, and they showed like a success rate between 85 and 90%. But treatments have evolved a lot since then. And so there are modern treatments such as something called gentle wave. And I think that we're going to see that's still fairly new. Even if it's 10 plus years old, it's like that's still pretty new. And I think we're going to see a much higher percentage of success in the future with modern treatments. Old treatments, and I tell patients if they elect a root canal treatment, don't ever get it done by a general dentist. You have to go to a specialist. General dentist doesn't have the repetition nor the equipment to do the most modern treatment, which is going to give you the best result or the highest chance of success. And I like to say too, if you choose it, you can always change your mind. If you choose to get a root canal treatment and then a year from now you're like, no, I don't care about the data now. I just really don't want this. Even if the x-ray shows it's fine, you can get it taken out. But if you just jump into that without really knowing the other side of the story and take it out. That's it.
It's
So
done.
yeah, it's done. You don't have an option now. Does that answer your question?
Yeah, absolutely it does. It absolutely does. And I think it's really nice to hear you be neutral. I think it's really nice to have someone that says not all root canals are bad because that can be absolutely the message that you receive online is do not ever get a root canal. And I think it's really nice to hear you say, no, they can be the resolution to some things. You just need to be informed on what the options are and just how sick your teeth are. Okay, I have only two more questions because I know we're out of time, but our oral health as a baby, you can get that if someone kisses you or an adult puts a fork in their mouth and then in your mouth. But what do we know about babies' oral development if there is no kind of cross-contamination like that from an adult? What do we know too about formula-fed babies versus breastfed babies? Does that impact oral health in our babies?
That's really interesting. To be honest, I don't know. I don't know the difference between, yeah, I'm not sure. Certainly it would make sense because the breast is and the breast milk is going to have its own microbiome versus a formula that's obviously not going to have the same. And oral bacteria is transmitted from person to person. We could take a couple that's been together for a couple of years and evaluate their oral microbiome, and it's going to be more similar.
Wow.
Yeah, and so that's why it's really important that if one partner has periodontal disease or chronic gum inflammation, we need to treat the other, test and treat the other as well.
Wow.
Um,
Okay.
and cavities, gum disease, we call those diseases communicable but not just transmissible, meaning we pass on the bacteria that causes disease, but it doesn't mean you're going to get the disease. Just like you can be exposed to someone with a cold and breathe in the air that they're coughing out, which is gross to think about, but it doesn't mean you're going to get sick.
Yeah.
You may get sick, you may not get sick. You may get cavities, you may not get cavities. But it's certainly, I tell parents, especially parents that are struggling with these oral diseases, don't share anything with your children. It's putting them at risk. And unless the research has changed, what I was taught was that babies are born without strep mutans in the oral environment, and strep mutans is the major cause, major bacteria causing cavities. So there's actually studies that has shown that you can, if you avoid saliva contamination or saliva sharing, that you can raise these kids without strep mutans. Now, of course, that's going to go away once they start kissing or have a partner. Like, but while they're kids, you can avoid that for the first X amount of time in their life. So, for what it's worth.
And I assume the same thing with sharing drinks with people. If kids are drinking after each other, then the same thing. We're passing it back and forth.
Yeah, and the higher frequency, the more likely to pass. It's not like a one and done deal, but that's why over time we see a shift in microbiomes to be more similar in partners, but it's not you go on your first date and all of a sudden you have the oral microbiome of your date that you just kissed.
You know that old Kenny gave you the cavities.
Yeah, yeah. So that's not going to happen, but we do know that there can be shifts in health, and I've seen that in my patients. I
Okay.
had one patient that didn't have a problem with gingival inflammation, and then we saw her for her checkup cleaning, and she had a lot of inflammation. And the hygienist went through the different risk factors and life changes, and one of the things that had changed was she had a new boyfriend.
Oh my
And
God.
so we're like, all right, you should get your boyfriend tested because that's the only major life change. You were healthy, now you're not healthy. What does your boyfriend's oral health look like?
Wow. Oh my gosh. Ditch him. Ew.
And we've seen
Kind of
that with
thing.
pets too.
Oh
With
no.
pets, yeah. Owners that that let their pets lick them can actually acquire periodontal disease from their dogs.
Oh
It's
no, that's
crazy. So,
disgusting. And I do
yeah.
love my dog kisses. I love my puppy kisses so much. Not on my mouth, but
Yes, just
you
don't let
talking
them be
like
in your
on your
mouth.
face or just not in your mouth?
I think on your, yeah, on your mouth.
Yeah,
So
no,
there,
I never let him like make out with my mouth, but I do let him kiss my face, and oh my gosh, I snuggle with my puppy all the time. Yeah, that's disgusting. Okay, Dr. Clayton, my very final question is I always like to leave people with tangible things that they can do in their life. So, in an ideal world, how do we best take care of our teeth? Take us from maybe our morning routine to our evening routine. What should we be doing every morning and night and throughout the day to give us the best pearly whites that we can have?
okay, so plaque removal is really important. So that or those oral hygiene habits twice a day, if you can, 3 times a day, if especially if you're fighting gum inflammation or cavities. So that's going to be key. With diet, what's most important, one, you're getting a good variety of nutrients. So you're getting the fat soluble vitamins, you're getting the minerals, you're getting everything that you need to have healthy saliva with good minerals that are going to protect your teeth, that a good immune system, fat soluble vitamins that are going to get things like calcium into your body in the first place and to its target destination in the body. Then with diet, one takeaway is that how you eat is more important than what you eat. Something that can really help to establish and maintain oral health is to have lots of periods throughout your time where your mouth is exposed to nothing but water.
Huh.
Now, xylitol is something that doesn't fit that bill so much because xylitol does function as a prebiotic for the good bacteria in your mouth, and it promotes more saliva production, and it targets bad bacteria. So that's something you can have in between. But having periods of what we say oral rest has a big impact throughout the day. Being careful with oral care products is helpful, and just making sure that overall you're healthy, that hormone balance is good, and addressing other sources of inflammation in the body. So those are some things that can be done to help improve oral health.
Oh my gosh, this has been such a good conversation. Thank you so much for joining me. If people wanted to learn from you or get care from you or just connect with you, where can people do that?
Okay, we have created so many great resources to answer all these questions because we get so many questions and there's not enough reliable data driven information out there. We have, our signature guide is the ultimate guide to curing cavities. And that was the first thing we started with. And that goes, if you're getting cavities and you're tired of getting cavities, you don't know why you're getting them, what to do about it, you feel gaslit, this guide is going to be a massive help. We love getting the reviews from our followers, our students that say, I used to have this problem. I used to get cavities all the time. I got the guide, learned, implemented, and I don't have this problem anymore. And then the other guide is more of an overview to holistic dentistry, and that's called the Functional Dentistry Roadmap. And that talks about gum disease and cavities and pregnancy and airway. So it covers so many topics under the umbrella of holistic dentistry and really systemic health. So that's a fantastic resource. You can bundle them together, and we'll give you those links so your listeners know where to find those resources. But the functional dentistry roadmap is over 100 pages long. The cavity guide is over 160. It's digestible, split into days, but we wanted to provide good, accurate information that's going to help you get well.
Oh my gosh. All right, you guys. I don't even really need to say anything else. You know why I had Dr. Clayton on this show. This was so informative. My cheeks are literally burning from smiling so hard.
Mine too. It's been so fun. I've loved this.
Yeah, this has actually been so much fun. And I feel like I've learned a lot. I had no idea that your hormones could impact your saliva, which could impact your gum health. I had no idea that, how much of a connection there was with oral health and the rest of your body. I feel like I had shallow knowledge, and I feel the research that I've been doing has opened my eyes. But today has really been so pivotal. You guys know I will link everything in the show notes for you, and I'll see you in the next episode. Be sure to follow Dr. Clayton on social media. You can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.